Healthcare in South Africa is very challenging. The biggest burden sits in the rural areas. It's a vast country. People have to travel big distances to access the correct care. How do you take a specialist out into a remote area? This is what we do at Pulukisa. Pulukisa means to heal in one of our local languages. We ended up building a cloud-enabled backpack, which tests for 10 most common diseases: HIV, tuberculosis, diabetes, heart disease. In our country, we've got a very, very high maternal mortality rate, of the worst in the world. And these are all things that are super important when you're screening a pregnant woman. The backpack can go on the back of a health worker, so you could literally knock on people's doors and screen them at their homes. The data is collected and uploaded to MySQL database in Azure. Almost immediately, the results are pushed back on Power BI and delivered to the clients, no matter where they are.
Precious came to our clinic as a patient who had a previous miscarriage, and she did not understand what's going on in her body.
On my first miscarriage, I was suffering from high blood pressure. Because of the lack of instruments, no one can help me. My child just died inside of me.
So when she came, we screened her to check all those things on a woman. To get the results will take about a week, but with the backpack, it takes just that 20 minutes.
Everywhere there are people with great ideas around the world. But what's the gathering place where these dreamers get together and have their ideas come to life? Microsoft. It's literally a place where we get to weave the tapestry of the future.
Now I'm 8 months pregnant. My child now, I'm going to call him Blessing. The new technologies is giving us a hope and a new bride. That even our generation, like me, my child, will be healthy. So I'm happy, I'm happy, I'm happy, I'm happy.
So I'm here with Dr. Raymond Campbell. Dr. Campbell, it's so great to have you here. Thank you for being here. The work you're doing is just so inspiring. Why don't you tell us a little bit about how this all came about?
Well, thank you, Satya. Thanks for having me. Growing up, I always knew that I wanted to help people, and it's one of the reasons I became a doctor. But the limitation with that is I can only see so many people in one day. So through technology and partnering with Microsoft, I'm now able to empower thousands of health workers and impact millions of lives every day.
That's amazing. What's there in the backpack?
So in the backpack, I mean, it's a solar-powered connected case with a tablet, Bluetooth-enabled measuring devices, as well as point-of-care blood testing capabilities. And this essentially allows for one to be screened at a very affordable way in their homes, wherever that home is, and literally makes the health worker an agent for change.
So that's amazing. So that means pretty much all of the cutting-edge diagnostic capability can go in this backpack connected to the cloud with the health worker.
Exactly.
That's wonderful. So what's next?
We've deployed quite extensively back home in primary healthcare, mining, and agriculture space. And some of our modules like HIV, pregnant mom, and mental health are amazing. The platform's constantly evolving, so we've now onboarded vision, hearing, as well as X-ray capabilities. And Pulukisa is a disruptive health tech company that is built in Africa to address issues that aren't necessarily unique to Africa alone. These are issues that exist all over the world. So if you were to ask me what's next, I'd like to partner with Microsoft to go solve for these problems wherever it exists in the world.
Absolutely. Affordable healthcare is so key. Thank you so much. It's such a pleasure having you here. Thank you. You know, it's the type of innovation.
South Africa and Africa as a whole have got a chronic shortage of doctors. Most of them are centered in big cities. I had trained as a surgeon, but I felt that we weren't reaching the people who really needed our services. And I thought, I cannot train doctors quick enough, but what I can do is make better use of their time by creating tools
that allows only what he needs to think about or to see. Our app allows the client to keep a partial record of their condition. A lot of our clients aren't sophisticated enough to know what diagnosis he or she has or what medications they're on. They don't need to anymore. The app will speak for them. For me as the clinician sitting on the other end, I look at it, I know exactly this is what your diagnosis is, this is what has been done on you, this is what works and which doesn't work. You could be sitting halfway across the country or the world for that matter, and I'll see the same information. The power of the artificial intelligence behind it, the power of the cloud behind it, allows for sensible answers to be garnered far away from where the doctors would be traditionally seated. A solution like this will allow the nurses to administer the testing and the interview and elevate that sister in her community because now she's part of care as opposed to admin clerk. I don't think that we would have been where we are if it wasn't for a partner like Microsoft. They've provided us with architects to provision on Azure and to make the product in such a way that we can monetize. We know what the repercussions are of not storing data correctly, having data breached. If the bar for compliance was a meter high, what we're bringing to the table with Microsoft security is 10 times what is required of us, and I'm very comfortable with that.
If the patients get the same treatment that is in the big cities here in rural area, there will be no need for them to go to the big cities, saving money for the patients, and it's also save lives because it's easier for us to see the client early and then that patient will be treated early.
What I do see happening is with tech and artificial intelligence, you'll be able to see where there are spikes in certain diseases and be able to see where trends are happening and plan better. The meaning behind the name of the company is to heal in one of our local languages, and that's what we're trying to do. I want everyone, for as far as I can see, to be accounted for. I want them to feel as if they are participating in the bettering of their own health, and I want there to be absolute partnership between us and them.